Chapter 8, Alcohol Screencast 6. This is the last screencast for Chapter 8, and this is actually focusing on alcohol use disorders, primarily alcoholism. When we look at alcohol abuse, it is characterized by a number of things. 1, failure to fulfill major responsibilities. 2, drinking when it is physically dangerous to do so. Recurring alcohol-related drinking problems, and also social or relationship problems. Alcoholism itself is characterized by cravings, loss of control, withdrawal symptoms such as nausea, sweating, anxiety, shakiness, and tolerance. So basically, it's going to take more alcohol to create the same sensation, and that will continue to manifest itself. Also, unsuccessful attempts to cut down use or to actually stop drinking altogether. The thing to remember here is alcoholism is a chronic disease and is thought to be so. When we look at the role of genetics, typically genetics account for anywhere from 40 to 50% of the risk, and this is verified through twins and first-degree relative studies in which they do share a tendency for alcoholism. The children of alcoholics actually have a 4 times greater risk of becoming an alcoholic themselves, but it is important to remember that genetics are not necessarily destiny, and if you are aware of something, there are steps you can take to protect yourself or prevent this from happening. The male to female ratio of alcoholism is 4-to-1. Women, though, are more susceptible to adverse effects of alcohol, such as liver disease, damage to heart muscle, various cancers, and also brain injury. Alcohol use disorders are highest among Native American Indians, and this has been well documented. Health burdens are greatest in American Indians and Black individuals. Also, Asian Americans have the lowest rate of alcoholism or alcohol abuse. Alcoholism is often seen with a number of other psychiatric disorders, such as depression, generalized anxiety. Also, it's not uncommon that individuals will use alcohol to actually self-medicate themselves through these times of problems. Abuse may actually aggravate or cause mental health disorders. And unfortunately, suicide and interfamily homicide is often related to the abuse of alcohol. The CDC estimates that the annual cost of alcohol abuse in the United States is $249 billion. What contributes to this is a loss of productivity, healthcare costs, auto collisions, and also criminal justice expenses. Now, when we look at the treatment of an alcohol use disorder, once again, primarily alcoholism, it involves 2 major things. The first is behavioral therapy, and the second is going to be medication. Behavioral therapy is going to be facilitated by a psychologist, social worker, or a counselor, and the goal here is to identify ways to compensate for the loss of pleasure that is associated with drinking. The ultimate goal is total abstinence. There are a number of medications that are actually approved for alcohol treatment. There is naltrexone, and this actually blocks the cravings for alcohol and the pleasure associated with intoxication. Acamprosate, this decreases the desire to drink. And disulfiram, and this causes physical reactions when drinking and blocks the complete breakdown of alcohol. Now, probably what we are more familiar with are mutual help programs that facilitate the recovery, and Alcoholics Anonymous is probably the one you're most familiar with. They are known for their 12-step program, and they actually include more than 2 million recovered alcoholics, and the only requirement to belong to Alcoholics Anonymous is the desire to stop drinking. Al-Anon, this is an organization that helps family members and friends recover from the effects of living with an alcohol-dependent person. Recovery rates reach 60% or more in most job-related alcoholism treatment programs. Here we're basically looking at the pathway that results in euphoria from the use of alcohol. So first, what they're noting here is the endorphin molecule. Endorphin are these opiates that we produce on our own, and you can see that the relationship here is with dopamine pathways. Now notice what's happened here. Instead of the endorphin molecule actually binding to the endorphin receptor, naltrexone is actually blocking that. So that is how this particular medication is going to have an impact with respect to the euphoria that is often associated with the use of alcohol.